Understanding drug-drug and drug-dietary interactions is crucial in the pharmacotherapy of gastrointestinal (GIT) medications. These interactions can significantly impact the efficacy, safety, and absorption of treatments, influencing patient outcomes. Drug interactions are an important anonymous root of medication errors, which express a notable risk of harm to patients and opportunities for healthcare systems. Polypharmacy is a major risk of causing drug-drug and drug-food interactions. Drug-food interactions occurs due to food influences the substances in medication that the patient is taking, influencing the viability of medication being regulated. Drug interactions are comprehensively split into pharmacokinetic and pharmacodynamics interactions. Pharmacokinetic interactions occurs when the absorption, distribution, metabolism, elimination process of the one drug is altered by another drug, and hence such interactions are also called as ADME interactions. Pharmacodynamics interactions happen because of alteration of the activity of one drug by another drug. This may bring about an improved response, synergism, a constricted response, antagonism, or an abnormal response. Proton pump inhibitors and clopidogrel. There is a reduction of the clopidogrel platelet anti-aggregation effect. So, cardiovascular risk increases with concurrent administration of clopidogrel and PPIs, cimetidine with benzodiazepines. Cimetidine elevates the diazepam and lorazepam absorption because elevated gastric pH may increase the weekly basic benzodiazepines absorption. Plasma levels of benzodiazepines were increases, and drowsiness elevated in patients. Cimetidine with cardiovascular drugs. Cimetidine increases the blood concentration of beta blockers and potentiate the actions of beta blockers. Proton pump histamine 2. Receptor blockers with vitamin B12 parietal cells also produce the intrinsic factor, and this factor required to absorb the vitamin B12. Gastric acid production decreased by PPIs and histamine receptor blockers, and it may lead to malabsorption of vitamin B12, magnesium aluminium hydroxide. Antacid with rufloxacin magnesium and aluminium salts present in the acid neutralizers can decrease the extent to which rufloxacin is absorbed. To avoid this interaction between antacid and rufloxacin, they should be administered with a time gap of at least 4 hours. Methotrexate with PPIs. Methotrexate poison levels are prompted when this drug is used at high dosages with PPIs. Ketoconazole with sucralfate, H2 receptor blockers, PP, is ketoconazole, a drug used to treat the fungal infections, is decreasingly absorbed with an increasing gastric pH. Gastric pH increases due to administration of antacids, H2 receptor antagonists, and proton pump inhibitors. If these agents were to be administered concurrently, there should be a time gap of at least 2 hours between the doses. Aluminium hydroxide, famotidine with tosfloxacin, magnesium, and aluminium salts present in the acid neutralizers can decrease the extent to which rufloxacin is absorbed. To avoid this interaction between antacid and rufloxacin, they should be administered with a time gap of at least 4 hours. Sonidegib with esomeprazole. The solubility of sonidegib depends on pH, lower solubility at pH greater than 4.5, but PPIs raises the gastric pH because it inhibits gastric acid production. The bioavailability of sonidegib decreases due to high gastric pH. List of GIT-associated drug-food interactions. Esomeprazole, high-fat meal, reduces the bioavailability cimetidine. Any type of food, bioavailability increases. Cimetidine caffeine. Effects increased due to decreases the metabolism of caffeine by cimetidine. Cimetidine ethanol, metabolism of ethanol is decreased by cimetidine. There is an increased concentration of ethanol H2. Receptor antagonists, nicotine H2 receptor antagonists may reduce the clearance of nicotine. Esomeprazole. Any type of food, any kind of food, alter the absorption of esomeprazole. 1 hour time gap necessary between consumption of meals and esomeprazole. Misoprostol. Any kind of food. Food reduces the early high peak plasma concentration of misoprostol acid, calcium carbonate, oxalic acid rich containing foods, spinach or rhubarb, phytic acid, bran and whole grains. Oxalic acid and phytic acid decrease calcium absorption, require minimum 2 hours time gap between calcium intake and foods rich in oxalic acid or phytic acid sucralfate. Orange juice.
Thanks for watching.
Upgrades,
Don't forget to like,
sucralfate
share, and
absorption.
subscribe.